Millions of people are going to be losing their Medicare Advantage plan for 2026. My name is Adrian, your expert at the Medicare Hub, and in this video, I'm going to explain who this is going to affect, why this is even happening, and exactly what you can do to make sure that you're not left high and dry without a Medicare plan to cover your health and prescription needs. So what's going on? Over the past year, there have been a number of new federal rules, tighter regulations, and rising healthcare costs that have contributed to a number of health insurance companies pulling back and scaling back the number of plans that they're offering. Because of these factors, health insurance companies are actually axing a whole bunch of plans just as if they were chopping firewood. Which means if you have a Medicare Advantage plan, there is a decent chance that you may be losing your plan for the upcoming year. You might be asking how these insurance companies can even get away with this. In order to understand that, you must understand how Medicare Advantage plans actually are offered and how they work. Medicare Advantage plans are not plans that are offered directly from Medicare or from the government. They form as a replacement for your Medicare Parts A and B and D as sort of an all-in-one plan that these insurance companies provide to you. Now, these insurance companies, they are contracted directly with the federal government and or Medicare to actually offer you guys these annual plans throughout the course of time. Which means that these plans are subject to change every single year, which also means that these insurance companies are entirely able to cut off an entire plan for the upcoming year if they so please. However, that is not something that they can do without first notifying you first. Every single year, insurance companies are supposed to send out an annual notice of change form. Now, this form is something that gets mailed out to every single person that are enrolled in one of their plans, such as a Medicare Advantage plan. Within this annual notice of change form, you're going to see exactly what's going on within your plan. So keep an eye out on the mail if you haven't received it already, and you would be receiving some information on whether or not your plan is going to remain in effect for the upcoming year, any important changes, or if your plan is just being cut off entirely. So let's say you're one of the people that are being affected by this big chopping block of Medicare Advantage plans that is happening right now. There's one of two things that will happen. One, you're going to lose your Medicare Advantage plan coverage and you will be reverted back to original Medicare, and that's Medicare Parts A and Part B. This option is what I personally see that is happening more commonly among the clients that I'm working with. And what will happen is if you lose your Medicare Advantage plan and you get reverted back to original Medicare starting the beginning of the upcoming year, that means if you had any prescription drug coverage with your Medicare Advantage plan and you don't do anything to change into a new plan for the upcoming year, then you'd be losing that in 2026. Not only should you be losing that, should you have any unexpected trips to the hospital, or if you go regularly to the hospital, you could also be faced with unexpected medical bills that you would be confronted with as well as a result of you losing your Medicare Advantage plan. On the flip side, not everyone is entirely losing their plans if a plan gets cut off. The insurance company also has an option to crosswalk you into another plan that is similar to the plan that you had. That way in the upcoming year, you still continue with coverage. However, like I said, personally among the clients that I've worked with, I just seen them getting reverted back to original Medicare. Now, what can you do to prepare and make sure that you're not getting the short end of the stick? Well, the good news is that currently it's an annual enrollment period, and that's October 15th through December 7th. And what that means is that everyone who has Medicare is allowed to make changes to their Medicare plans. If they want to go from their Medicare Advantage plan that is being cut off, or for any other reason, if they just want to jump into a new plan, this is your opportunity to do that. Or if you have a Medicare supplement plan and you decide that it costs too much and you want to go into something that's more cost friendly, like a Medicare Advantage plan, you can also do that, and vice versa. Now, any changes made to your Medicare plan during the annual enrollment period will take effect in the new year of 2026, which means that your plan will be active for January. Another thing that I also want to emphasize again is that if you are losing your Medicare Advantage plan, you won't lose your plan until the end of 2025, which means that you will have your plan until the end of the year before any changes take effect. Now, it might sound a little intense and like time is ticking, and honestly, you should feel that sense of urgency to get a new plan if you are one of the people that are losing your Medicare Advantage plans. However, there is still some leeway for people that have their plans that are getting cut off. So what's going to happen is that everyone that gets their plan cut off is eligible for a special enrollment period, which means that they can have up to 60 days to choose a new plan after their plan gets cut off. So they're not confined to the annual enrollment period of October through December to choose a new plan, which means you have until the end of February to choose a new plan and not be stuck with just original Medicare if you need more coverage than that. Now, if you're going to be choosing a new Medicare plan, you can choose between two options. You can either go for a Medicare Advantage plan, or you can go for a Medicare Supplement and Part D plan as well. Medicare Advantage plans typically can be free, and they cover doctors that are within a certain network, and they offer extra benefits that can include vision care, dental care, and hearing care as well on top of that. Now, if you like the doctors that you've been going to and they've been taking well care of you, an important thing to keep in mind when choosing a new Medicare Advantage plan is making sure that your doctors are within the network of the new Medicare Advantage plan that you choose. It'd be a shame if you don't want to lose your doctor, you get into a new Medicare Advantage plan, and then you realize that you can't see your doctor anymore because they're not in network with that plan. You'd also want to make sure that all your medications are covered, and when choosing a new Medicare Advantage plan, the cost of medication can be affected depending on the Medicare Advantage plan that you choose as well. Now, if you want to switch to a Medicare supplement plan, which actually works different than a Medicare Advantage plan, then you'd have the option to see any doctor you want. You wouldn't have to worry about your doctors being in network with the supplement plan because they cover any doctor that takes Medicare. Medicare supplement plans also typically fill in the gaps for whatever co-insurance or copays that you would have to pay, which means it's a good option for people that get healthcare more often than others. That way you wouldn't have to worry about the headache of constantly having to pay copays and co-insurance. Now, the one caveat I need to make sure that you guys understand is that with Medicare supplement plans, there is typically a higher monthly premium to make sure that that plan stays active, whereas Medicare Advantage plans, they can be free. Another important note with Medicare supplement plans is they don't cover your prescription drugs, which means that you'd also have to get a prescription drug plan and or Medicare Part D on top of your Medicare supplement plan in order to make sure that your drugs are covered. Now, these prescription drug plans also charge another monthly premium on top of what you're paying for Medicare supplement and Medicare Part B, so it's also something that is important to keep top of mind. So if you have a Medicare Advantage plan, keep an eye in the mailbox and look for that annual notice of change. You may have received it already and you may have ignored it. Please don't ignore it, as you could just be left without a Medicare Advantage plan if you do. Now, this can all be overwhelming, and I understand if you are. If you're looking for free, federally funded guidance on where to go next with your Medicare plan, just dial 1-800-Medicare and you'd be able to contact Medicare directly themselves for guidance. My name is Adrian with the Medicare Hub, and I hope I was able to elaborate and get you some important information on what's going on. Thank you for listening, and I hope you have a great rest of your day.